Hello, my name is Amber Dunn, and for my speech, I'm going to be looking out and pretending that I have an audience out in front of me. I'm going to be talking to you today about communication between medical assistants, patients, and doctors, and the importance of keeping the lines open. Communication among healthcare workers is vital to decrease medication errors, to make the patients feel comfortable, so everything runs smoothly. New medical assistants are at a greater risk for medication errors because, well, they're new. They may not understand the layout yet. So it's good to have them teamed up with a seasoned, another MA there, an LPN, somebody that's their go-to person in case they can't talk to the doctor right away. MAs have to ask questions no matter how vague the instructions were that the doctor gave them. Vague instructions leads to medication errors, so they may feel a little timid, a little intimidated to go ask the doctor, can you repeat that? So if they have to go find him and say, I'm sorry, Dr. Smith, I did not quite catch what you said. Could you repeat that? And as they're walking with them, they may be writing it down on a sticky note, and that's okay. It's important for even new or experienced medical assistants to have an open line of communication between them, the patients, the providers, other staff, because it's a team effort. It's a team thing, and you've got to have the open lines of communications to make the office run smoothly. Example of active and passive listening when you're talking to patients. When you're actively talking to a patient, you're down on their level. You may be sitting next to them while you're typing everything into the computer, and you're actively responding. Okay, yes, I understand that. And well, could you tell me how many days that's been going on? You're really engaged to them. It's your sole attention is on them, not anywhere else. You don't let your mind wander. It is on them. Now, when you go to the other part, which is passive listening, you're there, but you're really not there. Your mind is not there, your body is. So your patient's talking to you about what's going on, and you're thinking, I've got to go home and cook. I got to get Susie to the soccer thing. Oh, yes, I understand that. Oh, I don't know when tomorrow I got to open. So you're thinking of a million and other one things rather than concentrating fully and giving your patient your full, undivided attention. That's crucial. Can't explain that much more than that. And because if your mind is wandering, you're not going to catch everything that the patient says, so therefore you may miss something really vital. Dr. Martinez, Dr. Bigney, and Dr. Jernigan, the article How to Manage Difficult Patient Encounters, they did a few things. They were summoned to a doctor's office that was having difficulty with the line of communication between the staff, the doctor, and the patients. They collectively could not figure out why there were such problems. Well, actually, come to find out, it's on the front end. It's on the front line. It was us nurses, us medical assistants, us doctors, that were not taking the time to either listen to the patients or listen to each other. So they devised a feedback form that the MAs would fill out on the doctors, and the doctors would fill out on the MAs, and they met quarterly, and they talked about, what kind of things came up, but it wasn't a non-threatening position, non-threatening setting. Usually involved the office manager, the staff member, and the doctor. And they talked about it, and they found out that, a couple of them were kind of leery, this is going to be a gripe session, and that's all I'm going to hear. No, actually, the doctors learned a lot from the staff, and the staff learned a lot from the doctor. So they're using that form to give some feedback because they had either no idea how they were doing. They didn't get feedback from the doctor ever. They just got facial features like, oh, she messed up again, and off they would go. Never any, well, I didn't like how you did this. Maybe we ought to go with the procedure for how we should do this. There was none of that kind of feedback. So then they had staff meetings where everybody got to give their input on the forms. And one thing that an MA said was, the MAs are supposed to anticipate what the doctor needs. Well, you can't anticipate what the doctor needs until he tells you what he wants. So they kind of came up with a standard form of, okay, well, this patient comes in, this is what I want done. This kind of patient comes in, this is what I want done. So they found out that it worked, and 6 years later it's doing fine. So that study affirms the need for communication among all areas of everybody working in there, from the front office to the back office people to the office manager to billing to the doctor. It takes everybody. So that was a really good study that just affirmed it. You've got to have communication between everybody. Another important piece was mindful practice by Sharon Hull, which is emotional baggage. You leave your personal life at the door. When you get into that parking lot and you're ready to go in for that day, you leave your personal life at your door, at your car door. You step in and it's all about the patient. It's not about you anymore. So it takes a while to do that fine line of leaving your personal stuff at home and, you know, doing your work stuff without mixing them throughout the day. Because the patient's office visit is ultimately about them. It's not about you. It's not us thinking, well, when am I going to get lunch or what am I going to cook for supper? No, it's all about the patient. We're there for the patient. Patient's not there for us. It's the other way around. You might miss vital information if you're focusing on personal problems rather than giving them your full attention. Another way that med errors and miscommunication can happen. Another thing Dr. Hull touched on was dealing with difficult patients. This is really good, and it does fit in with the communication between the MA and the patients. Different patients, such as upset, mad, angry, hostile, require a different approach rather than your happy-go-lucky patients. I understand why you feel mad about being charged a no-call, no-show office visit, but that is our policy. Did something happen to make you not get to your appointment at all? You know, in a calming voice, rather than, well, it's a no-call, no-show, that's our policy, and that's just how it is, and that charge will stand. You know, there's two different voice tones there. Which one would you rather have? I'd rather have the first one and the more calming voice, because we don't know what happened. Maybe they had a flat tire. Maybe they got into an accident. So sometimes there's a reason. Sometimes I'll tell you, no, I just forgot. I teach my medical assistant students a poker face. You need to watch your facial features. You need to have a neutral look. You can't be going, oh, really? You know, it's got to be a poker face. Oh, okay. Well, I understand that. Let's see what we can do. You know, so that have a neutral look. With difficult or mad patient or upset patients, it's saying the right thing at the right time. You don't ever want to challenge the patients that are upset, mad, or angry, because you're not going to win between you two. You know, if they're shouting and stuff at you, don't you shout back. We need to say, okay, well, I understand you're frustrated. Let's go talk about it. You know, that way, there's only few words that can diffuse the situation. You must watch how you come across. Be attentive. Listen to the patient fully before you start to talk. Don't interrupt them. That's going to make them more mad. And talk to them in a non-threatening, calm manner. If you raise your voice, like I said, it's only going to aggravate them more, and it's just going to fuel the fire. Lead difficult patients maybe to an empty room to give them some privacy to talk to you instead of doing it out in the waiting room or at the reception front window. But stand by the closed door. Put the closed door behind your back. Don't put the patient by the door and you're way over here on the other side of the exam room. Because if they start to really get off the wall and really aggravated and really violent, you need to be able to have a quick escape route, and that's going to be your door. So don't ever put, you know, yourself in a position where you're away from a door or away from a quick exit. So in conclusion, communication is vital. It's a must. You must be open. You must watch how you respond, your facial features, you know, have that poker face on. You're professional. So we need to act like we're professional when we're communicating, and communication is verbal and nonverbal. If the patients feel that you're genuine and attentive, they're going to trust you. They're going to learn to open up to you and less likely to have issues. So it all goes back to keeping the communication lines open between the MA and the patient. Keeping the lines open between the MA and the doctor, so you fully understand, you fully take in all the information that he has to tell you. Same when you're dealing with the families. You've got to keep that communication line open. Got to keep it open with your fellow employees that are helping you too. So it's a team effort. A lot of things can be misconstrued if you don't listen. You can miss vital information. So medical assistants, anybody in the healthcare field, have to be an active, really attentive listener to take everything in. And I thank you very much today for coming and hearing my speech about communication between the medical assistant, the patient, and the doctor. Thank you.